So when you decide that you want to have a baby, you should visit your OBGYN before the pregnancy begins, because you want to be able to plan out your health ahead of time, fill in the gaps where you're missing parts of your care, such as vaccinations that are important pre-pregnancy because you can't get them during the pregnancy. You also want to make sure that you're in the best health possible. At your pre-pregnancy exam, it's a way for your doctor to get to know you. So they will ask you about your history. They will investigate if there's anything that they need to work on, in preparation for the pregnancy. They'll also do lab work to make sure that all of your levels are in the normal range. And they'll also offer you genetic testing if this is something that you're interested in. So the recommendations that the doctor may make are based on what you guys discussed during the pre-pregnancy visit and, what they identify on the exam also. So for example, if you need to gain weight or even lose weight, they'll suggest ways to do so. And then they'll also identify if there are any risk factors. And then you also want to make sure that, for fertility purposes, that you're decreasing your caffeine intake to about, 2 cups of coffee a day. And then also for, alcohol consumption, you really want to, decrease the amount where it's at most 1 to 2 drinks a week. So when we're referring to caffeine consumption and alcohol consumption pre-pregnancy, it actually is not as strict as compared to during the pregnancy because you're not quite pregnant yet. And so when we're referring to the effect on fertility, there's a little bit more leeway. The average time that it takes a woman to conceive depends upon if she was on birth control. If you were on the birth control pill, it can take 1 to 3 months before your period normalizes. So basically before ovulation comes back consistently. If you're on a long-acting reversible contraceptive method, such as Nexplanon and IUD, it can actually take up to 6 months. I tell patients not to be, too concerned if it takes that long because it's just a while before the body normalizes. None of these contraceptive methods, though, interfere with fertility. So it's important to understand that we still do encourage family planning and birth control, when you're not quite ready. If it takes more than 6 months when you're over the age of 35, then you should consider returning to see your OBGYN so that they can initiate the evaluation of why you're having difficulty. For those under the age of 35, we recommend that you visit your OBGYN after a full year of trying to conceive. Planning a family is a very exciting time in a woman's life. I'm honored to be on this journey with you.